time to move on. Do you remember that I mentioned 5 pillars of the conversations that we are having today? One of them was public-private partnerships. The next session is sponsored by the foundation of the global healthcare company Abbott, and is to talk about a unique and amazing public-private partnership with Abbott and the government of Tanzania. The aim of this public-private partnership is to enhance healthcare on a systemic level. So please welcome to the stage Dr. Teri Reynolds and our esteemed panel.
Thanks very much to all of you for taking your time and joining us today. We're going to start by showing you a quick video, and then we'll tell you about the folks on stage.
In the first 5 minutes, there is a lot to be done to save life. I grew up in a farming village near Mount Kilimanjaro. When I was around 12, my nephew passed away. I wanted to know if things had been different, could he have survived?
Dorcas is curious. I call her Curious George. She's exploring everything, always. Dorcas is my best friend. We are best friends. One day our mama called, told me Dorcas. She was hit by a motorcycle.
It was a code red triage, severe injuries. She was not breathing, lost a lot of blood, and had bleeding in the brain.
We began to have lost hope.
But we were trained for this, so we are ready.
On the 6th day, she opened her eyes. She opened her eyes and see us. Mixed feelings.
This is emergency medicine. This is the promise of emergency medicine. Dorcas survived. She came back to us. Now, what I was dreaming is happening. People are coming with no hope, but we are returning back hope to someone.
You know, like you're lost of something and you find it. That feeling.
Thank you, ladies and gentlemen, friends, colleagues I see in the room. Excellencies, we want to thank you for joining us today. We know there are many other things you could be doing with your time, and we want to extend our welcome. I particularly want to appreciate and acknowledge those from the Ministry of Health in Tanzania who are joining us. My name is Teri Reynolds. My current position is I lead a unit called Clinical Services and Systems at the World Health Organization in Geneva. But 15 years ago, I had the enormous pleasure to serve for a few years as the director of the residency and research programs in the emergency department at Muhimbili National Hospital in Tanzania. We're here today to share a story with you of a small group of people who worked together over the years on something that became what we could have never imagined. And I hope we can bring some of that story to you over the course of the next hour. To get that started, I'd like to ask each of the people on stage to introduce themselves and tell the audience, how did you come to Muhimbili, to that emergency department? What was your position when you first arrived? And what are the positions you've held since? Let me start with you, Hendry.
Thanks, Teri. I'm really humbled by the opportunity to be here today. My name is Hendry Sawe. I joined Muhimbili Hospital in 2009 as a junior doctor. And right away, I was posted to work in an acute intake area of the hospital, which was called casualty, and things were tough by then. In 2010, the first full capacity public emergency department opened at the hospital that I was working in, and I was among the first group of doctors that were posted to work in that department. In the same year, I was fortunate to be among the first 8 residents to join Tanzania's first emergency medicine residence training program. I graduated in 2013 as the first group of 8 doctors who were the specialists in emergency medicine in Tanzania. While I was training in 2011, my colleagues and I founded the Emergency Medicine Association of Tanzania, which is the national professional society, aiming at pioneering high-quality emergency care services in the country. I was honored to be the founding president, working with the Ministry of Health and the Abbott Fund to further advance emergency care in the country. When I graduated in 2013, I became the assistant residence program director, working under Teri, and then transitioned to become the residence program director. And in 2015, I was then appointed to be the head of emergency medicine department at the university. I served in this role for 7 years, while also taking on other responsibilities within the university, including being the director of medical services, as well as the director of planning and investment with the university. In 2021, I transitioned to Abbott Fund Tanzania, where I currently serve as the executive director, proudly focusing on advancing our initiative on improving emergency care services in the country, as well as leading the philanthropic activities in Tanzania. And I would like to welcome my colleague, Dr. Juma, to also tell us about himself.
Thank you, Hendry. It's my honor to be here today. My name is Dr. Juma Mfinanga. I'm the head of emergency medicine department at Muhimbili National Hospital. And also I'm the president of Emergency Medicine Association of Tanzania, which we formed in 2011, as Dr. Sawe said. I was joined Muhimbili National Hospital in 2010 together with Hendry as the first pioneer of emergency medicine care in Tanzania. Just after joining the emergency medicine in Muhimbili, it was very not easy because I was very junior doctor who was working in the emergency department at that time. But at that time, the emergency medicine was very naive into our country. But we moved there and tried to make sure that it's developed in our country. In the same year, I and my 7 colleagues, we joined the resident program of emergency medicine in the country as the pioneer of emergency medicine training in the country. In 2013, I completed my resident training and I became a specialist in emergency medicine. Just after I completed the resident program, I was selected to be the head of emergency department at Muhimbili National Hospital. At that time, I was very young and the young head of department in the hospital, in the history of the hospital. It's a little bit scared for me to accept the position, but because of teamwork which we had in the department, my colleague and my mentors, Teri being the one, I accepted the role. I and my colleague we made sure that the new field of emergency medicine is growing, and we worked hard day and night to make sure that that field has recognition in the country and across other countries in Africa and the world. I think I would welcome my colleague Catherine to introduce herself.
Thank you so much, Juma. I really feel very blessed to be on this stage today. My name is Shari. I am an emergency medicine specialist. Currently, I work as the physician to the US Embassy in Tanzania. I came to Muhimbili National Hospital in 2012 as a general practitioner from one of the rural hospitals. And this was the first time I was being exposed to emergency medicine practice. I liked everything about it. There was something very satisfying about this program that made me decide to do emergency medicine residence in the year after, 2013. During my residence training, I also got a very rare chance to serve as the chief resident, the role that my colleague, Brother Henry and Juma also had done it before. And during this time, I learned and exercised great leadership skills. These were part of the training structure of the program, of course. And right in 2016, after my graduation, I was immediately transferred to be the head of an emergency medicine department at Muhas Academic Medical Center, where I served for about 6 years before I joined the US mission in 2022, where I serve now as the physician to the embassy. Thank you so much.
Thank you, Catherine. And my name is Dr. Erasto Sylvanus. I'm working at the Emergency Preparedness and Response Unit of the Ministry of Health, Tanzania, as the head of emergency medical services. I graduated from medical school in 2011 from the Kilimanjaro Christian Medical College, which is situated at the foot of Mount Kilimanjaro. And then I moved to one of the zonal referral hospital in the western part of Tanzania called Bugando, where as a junior doctor, I was positioned at the emergency medicine department, quite a new department. So we started there as doctors. And then I joined the residency program 3 years or 4 years later in 2015, where I met Henry, Juma, and Catherine then as my senior and my teachers as well. So after graduation from 2018, I went back to my former hospital there. I brought that culture of the teamwork, the timeliness, the dedication to the patient care. So we had to influence the young doctors to join the further studies of emergency medicine, which was still lacking at my facility. Until a few years later, when I was asked by the minister to join the Ministry of Health as the National Case Management Coordinator, where I worked for like 2 years, and then I transitioned to the current role as a head of emergency medical services. So that's my short story.
Excellent, thank you, Erasto. Melissa, you hear the incredible evolution of the program over time, even the brief time of these generations of doctors within it. Tell me a little bit about how, if you can introduce yourself, and tell me a little bit about how Abbott Fund got involved in this from the beginning.
Thank you, Teri. Really honored to be on stage with the physicians here who are the pioneers of emergency medicine in Tanzania. I am Melissa Brotz, president of the Abbott Fund, which is the foundation of the global healthcare company Abbott. And I'm also vice president of global marketing and external affairs. And we lead the philanthropic and sustainability programs for the company around the world, including the one you're hearing about today in Tanzania. Abbott first got involved with the government of Tanzania in providing programs for children affected by HIV and AIDS in the year 2000. So it's a 24-year partnership. And that quickly evolved into more of a healthcare infrastructure and capability building partnership. Initially, we built an outpatient center, a 4-story outpatient center at Muhimbili National Hospital, so local people could get more immediate access to health care. And then we worked with the government on renovating and building out the national lab system, first at Muhimbili National Hospital, but then in 23 regional hospitals throughout the country, connecting them digitally with an IT system so they can talk to each other. And it was about 2006 where we realized this was a long-term commitment, and so we established the Abbott Fund Tanzania. Hendry mentioned he's now the executive director of what we call AFT, and that allows us to have local people on the ground working to both build and expand and build capabilities. But it was about 2008 when His Excellency, the former president of Tanzania, President Kikwete, asked Abbott Fund to build an emergency department, and that is how the journey started.
Thank you very much, Melissa. And to bring this into sharp relief, I want to ask the two of you, I remember the day very specifically. I can still see it. I remember the day that I met you, Hendry and Juma. And Juma, you were literally, not metaphorically, but literally bouncing up and down on your feet, as you do. Yeah. And Hendry, you were standing, as you do to this day, very quietly and dignified next to Juma. And I looked at the two of you and I thought, okay, let's see where this is going to go. So can you share with us, Hendry, you, and then we'll come to Juma, share with us a couple of examples. So much has happened in 15 years. Give us a couple of examples that describe really the difference between that moment and this one.
Yeah, thanks, Teri. It's true. You know, a lot has happened over the years. Looking back before 2010, in Tanzania, there was no emergency medicine training program, and there was no emergency medicine specialty. And so, looking back, I went through medical school for 5 years. And I never trained anything in emergency medicine because that was not part of the training curriculum. And so graduating from medical school will mean that you're going out of medical school as a doctor without necessary emergency skills to save a life. And that really also translated to other health specialties, including the nursing programs as well as the allied health sciences. And so in essence, you'll come out of the university or medical school without a knowledge to save a life, and usually we know the first initial 5 to 10 minutes are really critical when it comes to an emergency situation. And being a junior doctor in that situation, it means that if you wanted to go into emergency care or if you wanted to practice emergency care, you will have no foundation of training, so you will not have necessary skills, as well as the infrastructure, that is the emergency department, will not be there because at the time there was no emergency department in the country. And so this also translated to the nursing program as well as other cadres in the health. You know, secondly, when we were starting to train in emergency medicine, you know, most of the guidelines that we used were really informed by the evidence that came out of high-income countries, and these were great resources. However, over the years, a lot has really happened. The research that is being conducted at the Muhimbili National Hospital by the doctors and students have really become the body of literature globally, and they're now informing guidelines that are used both internationally and locally. And this is quite important because the guidelines that are being made should really reflect the context of the disease burden within the country, because the disease burden, the pattern between different countries, high income and low income, are obviously different. And so to me, those are really two critical things that I can look back and say these have really changed.
Excellent. Thank you, Hendry. Juma.
Yes. Thank you, Teri and Hendry, for, I can say that as a result what Hendry is saying, what is happening, it's also impacted the clinical care significantly. I can give some examples. For example, number one, when I was working as an intern in Muhimbili National Hospital in 2009, 15 years ago, and if a child come in with a difficulty in breathing, they will arrive in a room called a casualty, and then in that room, they were sorted in admission ward without any initial stabilization or resuscitation or treatment. Due to that, some of these children died because there was no a model of real emergency care at that time. But with all these changes, the same child, if present in the hospital with this time, will be received in a well-capacity emergency department and immediately taken to resuscitation area for urgent management. Only until the patient is received diagnosis and stabilization is when they will be admitted in the admission ward. And this has changed significantly in saving a lot of people. Second example, which I can share, 15 years ago, a patient who is referred from the primary health care, a district hospital, might not received any emergency resuscitation before transferred to the hospital. Also, we as a receiving hospital, we might not have any information about the patient. As the result, we get late information, and sometimes few of these patients, they lost their life. But with now, a lot has changed. Most of these patients, they receive initial resuscitation at the primary health care before transferred to high level. And even us as a receiving hospital, we get information prior. And also we be involved to provide how the patient can be transferred safely to the hospital. This has expanded significantly the emergency care in the country to the level of primary health care. And by this, it really transformed the outcome of the patient. But I can say it was not a good, easy job. It took us an effort and advocacy to make this happening. And the experience which learned at Muhimbili National Hospital was propagated to other areas of the country. And as now, we have more than 100 emergency departments in the country which are providing care at the level of primary health care. This new field of emergency medicine is currently has a recognition in the hospital and in the country in general. Furthermore, we have our professional society is linked with our government to make sure that we are linked to other African countries and across the world through the collaboration of other international professional associations. I think that I can say some of examples is how we transformed from where we are 15 years and now. Thank you.
Thank you, Juma. So Melissa, let me come back to you because this began, as you've described, as a kind of infrastructure investment. The idea, build an emergency unit. But what we're actually hearing is a story of a kind of incredible investment in human capacity in a group of people. And it's not only these on stage, but they represent a larger group of people, but an incredible investment in kind of human capacity in people who started as doctors, became excellent clinicians, but then became leaders and transformed their system. So tell me, how did the evolution of this program occur? How did we get from an infrastructure idea to this kind of investment in human capacity?
Well, our goal is always sustainable impact. And if you're going to have sustainable impact, then it's about a lot more than bricks and mortar, right? You can build nice buildings and have all the tools, but it's kind of an empty shell if you don't have the human capability and capacity. So we knew that that was going to be a critical success factor. So we also knew that Abbott were not experts in emergency medicine. And so we needed to partner. And that's when Teri came along with University of California, San Francisco. That was the initial part of the partnership. But then we expanded that and built a consortium of leading academic institutions really from around the world. And they brought in emergency medicine doctors, nurses, and we looked at the training long term. What would we need to do immediately, and what would we need to do longer term? So the first phase was really around training the existing staff at Muhimbili. And so those doctors and nurses trained Muhimbili staff side by side. The second thing that we did on a parallel path was developed an emergency medicine residency program at Muhimbili University. And again, that same consortium became the faculty. And for the first several years of the program were really instrumental in that training. And now local physicians are the teachers of the program. So the first graduating class was in 2013, and Juma and Hendry were part of that class, and Catherine and Erasto followed. So they've been having impact ever since.
Thank you very much, Melissa. So I really want to take a minute to emphasize how exceptional this evolution is from an educational program to something that has really been leveraged for health system transformation. And to give a sense of that, Catherine, let me ask you, so you started as a clinician, you are an excellent clinician at Muhimbili, and now you have taken those skills outside the walls of Muhimbili. You're now the physician for the US Embassy. Tell me a little bit about that progress, that evolution.
Thank you, Teri. And maybe for this one, I'll go back after medical school.
Sure.
So when I graduated, I was sent by the Ministry of Health to a rural hospital to work as a general practitioner. As Hendry said, remember there is no emergency medicine knowledge in the basket. So this didn't go very well. I witnessed a lot of preventable deaths and suffered the moral injury of not being able to do the right thing because of lack of supplies, expertise, and almost non-existent system of emergency response. So when I walked to the ER of Muhimbili National Hospital in 2012 as a new employee, seeing all these critically ill patients being rolled in stretchers, I cried. I begged the management to take me anywhere else in other department, but not there, because I thought all these people are going to die. I've seen this movie in the rural area, and I wasn't ready to go through that again. But to my surprise, the ER providers were actually saving lives, like in a movie. So I met a group of well-organized, committed and passionate people, Juma and Hendry, among others, being led by Teri. And I remember standing there and saying to myself, I don't know where these people are going, but I'm following them anywhere. They're just amazing, and I want to do what they're doing. So this work that was done in this one department became the source of power and massive force of attraction for many people and stakeholders. And through Emergency Medicine Association of Tanzania, we kept that alive and duplicated it in every other emergency department that was being built in the country. The funny part that I need to say is graduates from this program showed exceptional qualities and leadership skills. Wherever you placed us, we would shine and bring the theme of quality emergency care to light. So Thank you so much, Teri. I love to share that.
Thank you, Catherine, for your story. Erasto, you now, this is one of my favorite things, right, where we barely overlapped in the program.
Yeah.
And your entire progress, spectacular progress through the program, happened later, after I was long gone. And you're now the head of Emergency Medical Services at the Ministry of Health of Tanzania. So tell us what that transition was like for you, from an excellent clinician serving the needs of individual people seeking care, to the kind of work that you do now in policy and in organization.
Yeah, it is very interesting how things has turned out to be. After graduating from Muhimbili that year, 2018, having received all the knowledge from the pioneers, my colleagues, I've mentioned, I moved back to Bugando, the western part of Tanzania. It is a zonal referral hospital. It is serving quite many regions, like 8 regions, bringing patients there. So there was a lot that I learned. As a clinician, I learned the successes from what I came with and my colleagues. I learned the challenges that were still there. And then COVID-19 came. We are part of the team that led the emergency care services for COVID-19 patients. That experience from the regional level and my transitioning to the Ministry of Health as the coordinator for case management of cases. My initial role then was to in the planning and coordination of emergency services for COVID-19 across the country, having known that the real situation, the reality, and what works, having received the knowledge from the findings from the researches that have been done locally, plus my experience in Bugando, was very easy for me, despite the other challenges, and together with the team, to plan to expand this service across the country, to lead the teams of frontline health workers in the fight of COVID-19, the essence of the emergency care and the impact it could have provided. As we have seen in one hospital, like overall hospital mortality went down more than 40%. So we could duplicate that across the country. So it was easy in that planning. And you remember during that time, other clinicians were a little bit hesitant to face the patients, the COVID-19 patients. We are flooding. But the emergency care team, of course, and the other teams were leading the front row. So that, plus the establishment of infrastructure for emergency departments across the country, led to the overall preparedness of the capacity in the emergency care systems to improve, and that in the end was contributing to the overall capacity of the nation in emergency preparedness and response for public health emergencies in general.
Perfect. Thank you, Erasto. And I want to pick up just on one more thing from you. So we've talked a lot about the past. This is clearly, you're now representing the government in this partnership in the present. So what's the next horizon? Just very quickly, what's the next horizon for this partnership going forward?
I'm looking at it as, if you look before and after, before that partnership was between Abbott Fund and one hospital, like Muhimbili. And then it transitioned from one hospital to other hospitals across the country. Where I'm seeing this, which is already happening, is taking the expansion from hospitals across the country to the community now, and from the community to the world. What I'm seeing, the partnership where it is going is the expansion of the emergency care services beyond hospitals. So we are targeting at expansion of emergency medical services in the country by having coordinated ambulance services, training of clinical basic emergency care to all acute care settings, all the emergency departments from primary health care to the national care. But we are also focusing on having the well-established ambulance dispatching system, training the dispatchers training even the specific groups that are potential for emergency care in the community, like the police, the motorcyclists, the drivers, to have that sense of first aid, you know. So that overall is bringing the emergency care from the hospitals to the community, and this one is the most impactful thing that we are heading, and I think the future is brighter.
Thank you, Erasto. Melissa, just to come back to you, so we have sitting here 15 years of people who've engaged with this partnership, who've built this capacity, this infrastructure, these processes that exist in the country now. Most people, many of us have been involved in partnerships. Many people in this room, I suspect, are currently and in the past and will be in the future part of partnerships. This one seems particularly impactful and sustained. What is it from the fund's point of view, from Abbott Fund's point of view, what is it about this partnership? What went into this to make this partnership so successful, so lasting?
I would think from our end, I think there are three primary takeaways. So the first is to be an intentional partner, one who is willing to roll up your sleeves and solve problems together, right? There might be an initial discussion of what this project is going to be. It never ends up that way. And so the importance of being there and working with the people that you are so supporting and serving is really important. And that's not always easy, right? Governments, companies, foundations, NGOs, they all have different ways of working and different priorities. But I think when you have a common vision and you can bring all of those sectors together and work across the sectors, then you have a really great opportunity to have real and lasting impact. I would say the second thing is we listened. First, we listened to the government of Tanzania, and they set the healthcare agenda. And I think they were brilliant and prescient because they understood that building these foundational capabilities, whether it was outpatient services, whether it was labs or emergency medicine, this was a way to bring healthcare access to more people in more places, and to build their national healthcare capabilities. And then we listened to the people on the ground, people like Juma and Hendry and Catherine and Erasto, who know what it takes to serve people. And it's different if you're in Dar es Salaam, a big city, than if you're in Bantu village, right? So you have to listen everywhere you go. And I think, you know, part of that listening included the highest levels of our company. Our former chairman and CEO, Miles White, visited Tanzania on a number of occasions, met with the government health minister at the time, Anna Abdullah. My predecessors and I visit frequently, and we have an excellent team on the ground. So that leadership commitment across on both sides of the equation is very important. And then I think the third thing, which sometimes people don't like to talk about, but is the financial and administrative aspect of this to build sustainability. The emergency department, we built an operating model that included a business unit that had finance, IT, and administrative process. They charged fair prices to those who had insurance, and that helped subsidize those who didn't. And we went from a donor-funded model to a self-sustaining model for the emergency department in less than 5 years. And the surpluses that Juma's department now generates are reinvested into the hospital. And so when we reached that milestone, we knew we had success. It was important for all of us, and it reinforced that long-term commitment that you need to have. So I'd like to turn the tables on you, Teri. You and Hendry have worked together in a number of different ways since you met at Muhimbili back in 2009. Could you give us a little insight into sort of the current global context in emergency care?
Sure, yeah, thank you. It's really changed so much. And Hendry, you and I have worked together in so many ways in so many places, in the hospital, in the university, night shifts, day shifts, you know, working at the bedside, completing grants, working together even at WHO. And it feels like it's so different now than when we began. Not to say this was responsible for that, but really the world has changed so much. Countries weren't even really asking themselves the question of how to strategize emergency care, of how to do that effectively at the time. I remember we were speaking to people and having to first even define the topic before we could have a conversation. So where do you think that is now? Like, what's your feeling about where that is now for countries?
Yeah, you know, it's true because back in the days, emergency care was not even in the question for most of the countries, right? So it took a lot of effort to even explain the concept of what emergency care is, you know, and as I've just alluded to, today, when you look forward, a lot of transformation has happened. Emergency care is a core component of emergency care of healthcare system in most of the Ministry of Health. The training, you know, has been embedded in most of the curriculum within different institutions. And the ministries of health within the region have really taken on emergency care and made it an integral component of healthcare system. And not only taken on, but also made an active step of taking an initiative. Giving a specific example in Tanzania, building emergency department as well as the program and making it one of the important national healthcare agenda has really transformed the landscape. But when you look beyond that, at WHO, we've had 2 World Health Assembly resolutions, you know, on emergency care systems, which really provides the instrument for the countries to be able to advance emergency care system. And from that, we've had World Health Organization Toolkit, which really is now helping the country implement these initiatives within the countries. And most recently, I just think it was last year, we've had another World Health Assembly resolution on emergency care, you know, and emergency critical as well as operative care, which is really an important one. And from that, we have the global agenda and action plan that is coming along, right? You want to tell us about that?
Sure, yeah. So many of you may work regularly with the World Health Assembly, the convening of all of the health leads from every country around the world, from ministries. And some of you work with resolutions every day, some of you may not. But we have, for the first time, an extraordinary opportunity and something happening right now from this May. As Hendry mentioned, there was a resolution last year, and then from this May, there was a call by all the countries for a global strategy and action plan. And so we're currently in the middle of that process. We're in the phase of expert consultation that then goes on to the regions and then goes on to all of the member states, so to all of the countries to revise and respond to that. And what it does is it doesn't solve all the problems. That's up to you guys that are between us and high quality emergency care. But what it does is creates a framework for coordinated action. It gives people a place to focus, and it gives us a mandate from, you know, we at WHO, we're a member state, we're a UN organization, but unlike some of the others, we're a member state UN organization, and we take our marching orders from the countries, and they express that through the World Health Assembly. So, and they express what they want countries to do and what they want WHO to do. So we are all about to have a global strategy and action plan that breaks these ideas down into very concrete actions. And can you imagine, we were, you know, scratching at the window trying to get the grown-ups to listen to us back then. And I cannot imagine what it would have felt like at that point to have a global strategy and action plan in this area.
Absolutely, so, yeah. You know, and most of that right now has been institutionalized for most of the programs that are there. You know, Ministry of Health have taken on these programs and made it part of their usual healthcare system. And that is really important because once you have an institutionalized agenda, then it creates an opportunity for ability to scale up, but also ability to sustain. Initially starting as just a donor-funded initiative, and then moving to become a global agenda within the WHO, and then coming back within the country and being bought by the Ministry of Health and making it an agenda, that really guarantees the sustainability. That really guarantees you can scale it up. That really guarantees that you can take it and make it an example to other countries. And that's really what the focus has been. And you know, looking back, this has really been an initiative of a group of people. Some of them are here today, you know, and taking this as an institution, one hospital initiative, and then making it and transforming it to become a global agenda. You know, it's a lot of effort from individuals, you know, and it's something that when you look back, there's a lot of reflection that you can make, especially for the people as well as the achievement that's been made today, right?
Yeah, and it does make me think a lot. There's many of the people we worked with here on stage, but it does make me think a lot about other people we worked with. And I do want to take a minute to acknowledge there were 3 people without whom this wouldn't have happened. All of whom we lost way too young. So there were 3 foundational people within this project who all died before the age of 50 over the years. One of them was Alwyn Mzirai, the original kind of lead for the education program, someone who I stepped into that job, Hendry stepped into that job, and Juma stepped into the part of that job that was leading the emergency unit. One of them was Upendo George, who was part of Hendry and Juma's first class, and she was the head of pediatric emergency medicine, and there are a couple of incredible smiles on this stage right now, but nothing like hers.
Exactly.
And Upendo, her name means love in Swahili, and she brought that to us and kept us going. And then the last is Natalia Lobue, who we lost very recently, who came to us as a nurse. In the very beginning of the program, we were working together to design some of the education programs. She ended up working for Abbott Fund and was the last person to hold the head of the head of Abbott Fund position that Hendry currently holds before. And Natalia reminded us over and over again that this is really not about doctors. This is about care, and that kind of takes everyone, and that nurses really lead us in care. So I just want to take a minute to remember those 3 people. They completely changed the way that we think and the way that we do things, and all 3 of them changed the way that I think and behave at the World Health Organization. So yeah, just a moment to remember those guys.
Yeah, you know, Teri, I couldn't agree more. And I think honoring their legacy is one of the things that is really critical and really important to us. You know, and particularly when you're trying to think about what they believed in and what you believe in trying to advance emergency care in the country and making sure that emergency care is available, is accessible to anybody, regardless of the geographical location, regardless of the ability to pay, you know, and creating the systems that can enable that access to be available, as well as sustaining that access, is really one of the ways in which we're trying to honor their effort, and also is something we believe in strongly, is something we're working on day in, day out, and making sure that we keep smile wherever they are by showing that the access can be attained regardless of the context where you are and economic resources available. Yeah.
Great. I can't imagine better words to close on than that. So I really want to thank you for your time and for choosing to spend it with us today. We hope there's something in this story that you can take forward into your own work. We've seen a few things, and I'll just do my best to summarize them quite quickly. The evolution of a group of remarkable individuals to become excellent clinicians, and then finally, though, to become transformative leaders. The evolution of a facility-based program that went to many facilities and then went to a country for nationwide change, and then went beyond that. Fundamentally, one thing I think that's really important to take away, because I think this isn't widely recognized. I go to a lot of countries in my day job now. I talk to a lot of leaders and I talk to a lot of governments. But this really was the story of an infrastructure investment that evolved to an educational partnership that was really then leveraged for health system change, for health system strengthening, and a kind of sustainable, it's not the only way to create sustainable change, but it is a way, and it has been a very powerful one. So the leveraging of an educational partnership to create sustainable health system transformation. I think we can't underestimate how powerful that's been in this example. We've also heard about the importance for sustained partnership of communication, of listening, and of using that listening to ensure context relevance. This isn't, we hope you take something from this, but this isn't a one-size-fits-all story by any means. And I really want to emphasize, because we didn't spend a lot of time on it, and that does not reflect its importance, but this idea of the critical importance of business architecture to achieve the goals of philanthropy, but also of education and of clinical care for financial sustainability and long-term success. And there are a lot of ways to do that also, but this idea of business architecture is often in a separate place, in a separate category from these kinds of initiatives. You've heard me, you can tell how I feel about the people on this stage, and you've heard me use a lot of superlative adjectives about them to describe this group of people and their work, and all of them apply. All of them are accurate. But I do want to emphasize something, and that is that there is more than one person up here, and they come from multiple generations of this program. The reason I say that is because the individuals up here are remarkable. They're some of my favorite humans on the planet. They are extraordinary, but they are not unique. And it's really important that we believe that. This is not a narrative of exceptionalism. It is not only a narrative of exceptionalism. There are others like them. There are others in their cohorts. I had the pleasure of being part of some of these classes, and there were many beyond me. But there are others like them in their cohorts. There's others like them in Tanzania. There's others like them in other countries. And the reason I say this, everywhere in the world, this is a story of practical action that can be taken elsewhere. It's a story of investment in people and processes, a story that only little was told of enormous hard work and some incredible sacrifices that all of the people up here made. And I don't say that lightly, sacrifices, I mean it, sacrifices, things they do not have that they would have had otherwise. But it is not something that is impossible to do elsewhere. It is a story of the transcendence of what a group of people can do together that they've never would have been able to do alone. I emphasize this because I want you to look at these people, look at their faces, and look at their ideas, and don't let anyone ever tell you that this can't be done. Thank you very much for joining me.